Another question is about wearing face coverings when out hiking and mountain biking, for example. And from a public health perspective, think about it from that situational standpoint. If you're indoors closer than 6 feet with individuals other than family members, assuming they didn't have an exposure or a positive case, that's going to be different than when you're out in fresh air, moving about. So I think it really makes a difference on the exposure situation. Close contact for more than 10 minutes, and that's when you're having conversations, the potential for coughing and sneezing. So I would say you're out hiking with family members or mountain biking, you don't need to wear face coverings. You come into town and you stop at a restaurant with a group that you've biked with, then it's a good idea to wear face coverings, except while you're eating or drinking. So we also have some more questions. Let me get this written down. Okay, so one of the questions is related to gatherings, public and private gatherings. I know that's subject to interpretation. The gatherings of no more than 50 that will be allowed to take place, does it apply to camps and tournaments and events like that? So when I think about public events, I think about those as major sporting venues where people come to observe, like a semi-pro sport, for example, or parades or weddings. But I wouldn't include a camp, for example, where that's organized with social distancing. I know a lot of camps and employers are doing temperature checks, face coverings. So we'll provide more detail on that this afternoon with our orders, and then also have our call center available to answer questions about specific scenarios. There's also a question about maybe how I feel our communities are doing with complying with our recommendations. And my impression of that is it seems to come and go with what ends up getting reported in the media. So there are times where, for example, if I'm out at a grocery store, all the employees are wearing face coverings and most of the patrons are wearing face coverings. And then where we've had about a month of relatively low cases, it seems to have shifted the other direction where it's far less common unless the employer takes the initiative to require their employees and their patrons to wear face coverings and structure the patron flow to accommodate social distancing, then it becomes less common. And to be honest, I'd say the last 2 weeks, it's far less common than what we had going on maybe even a month ago. So that's something we have to get back in practice. It's, again, it's not just one employer or one environment. This disease spreads. It doesn't discriminate based on a person's age or sex. It's highly infectious when given the opportunity to be transmitted to other individuals. Another question is around long-term care facilities. So we are going to restrict or basically prohibit visitors from visiting long-term care facilities and other congregate facilities like with our correctional facilities. And the reason we're doing that is, number one, the the population who are in long-term care facilities are the most vulnerable. And if you look at our data, anybody over the age of 80 who has been infected, they have a really high chance of that disease becoming fatal. It's around 30%. So we have to keep this out of our long-term care facilities. Clearly, there's going to be employees who are out in the community and other essential staff that are required to provide care. So it doesn't include those, just visitors. And I know how difficult that is. And then as far as the congregate facilities, the challenge becomes if you have an infected person in a jail, workers or inmates, for example, it becomes really difficult to manage because of the need to isolate. They need a certain number of staff, and their ability to isolate inmates becomes challenging. They're definitely prepared to do that, but it's a challenge. So another question came in, and this is something that we gave serious thought to and haven't moved on that yet, is the idea of mandating face coverings for pretty much everyone in Ada County when you're out in public. So it's not part of our order, but it's something that we will consider. And again, we don't have many tools to stop this infection, but we know that hand washing, social distancing, and face coverings, especially when you're within 6 feet for prolonged periods of time, it's absolutely essential. So right now, we're going to rely on voluntary compliance to wear face coverings when individuals are out in public, but it may come to that at some point. Okay, being no further questions, we'll go ahead and wrap this up. We are, again, monitoring this situation very closely. We have a large team of disease investigators who provide the data to myself, to our Board of Health, and to the general public. We recognize that the restrictions being put into effect Tuesday night, essentially Wednesday at 12:01 a.m., will not impact what we're going to see this week or even into next week because of the delayed time from exposure to onset of symptoms and people testing positive. Cases continue to rise at the rate we've seen this past week. I'm certain we'll need to put more restrictions in place. And the last point I'll make that's been made over and over again is the importance of social distancing, wearing face coverings when out in public, and staying home if you're sick, even if you have very mild symptoms. It's critical to avoid people in the public, and also make sure you stay away from, in so much as you can, even from family members. We have the call center available to answer any questions. I'll repeat that again. It's 208-321-2222. The orders will be published on our website later today. And I really appreciate everyone's time and doing the right thing out there so we can get this disease in check and get things open back up again. Thank you.